Hello, we are here to demonstrate how to use the Remodulin pump, also known as a CADD MS3 pump for subcutaneous infusion. Just some things to remember: when you receive the medication from pharmacy, it will come up in a 3 ml pre-filled syringe. However, the label will not come attached to the syringe, but will be inside the bag that the medication came in. When your patient isn't on Remodulin, make sure that you have a second pump available at all times. And if the unit doesn't have any, you can borrow one from CVICU. The Remodulin orders will be coming from pulmonary hypertension team. Batteries are changed every 48 hours along with the medication and syringe tubing. When you need to change out the medication and tubing, have the other pump primed and set to the appropriate dosing ready before switching. Remodulin has a half-life of 3 to 4 hours. You don't have to be in a hurry to change out the pump, but just make sure that it's connected appropriately in a timely manner. Make sure you clean the pump after use with soap and water. Do not use alcohol to clean your pump. Make sure you have a clean area to prepare your supplies. As always, use proper hand hygiene, wash your hands, and don clean gloves. The supplies you need for your Remodulin pump infusion: your Remodulin pump, your medication that comes in the syringe, a coin, AAA battery, and your catheter and syringe tubing. There are two types of catheter: the 13mm and 17mm catheter. The 17mm catheter comes with tubing already. The 13mm does not. If you need the small catheter, you would need to get both a 13mm and 17mm packet and just discard the 17mm catheter. The supplies are located on the top shelf in the Neuro NICU closet near room 4 in a box labeled Remodulin. How to use the Remodulin pump. So go ahead and take off the syringe cap on the right side counterclockwise. And then with the coin, also turn the battery cap counterclockwise. The pump already comes with the battery positive side up. This indicates that the pump is in the off position. To turn on the pump, flip the battery positive side down. Turn the battery cover clockwise and tighten completely. Pump may turn off if battery is not securely in place. Once it's tightened completely, just wait until the pump turns on. The pump will alert that cartridge is removed and prompt you to begin the loading process, and the pump will give you directions. Just to remember, it is not a touch screen, so you have to use the up and down arrows and the buttons on the bottom. So go ahead and press OK. It says cartridge menu, load, fill tubing, and fill cannula. We'll only be using the load and fill tubing. We will not use the fill cannula. So go ahead and select load. Now you're ready to load it. So go ahead and take your syringe. Make sure that again it's a 3cc syringe. Take off the plunger and put it inside. And then turn it clockwise a 1/4 inch to secure in place. Go ahead and press load. There shouldn't be bubbles in there, but that's okay. Okay, so go ahead and put the syringe cap back on. So go ahead and attach your tubing. Select fill tubing. Select. press start. The tubing will fill to 0.3 mLs. The tube fill volume is approximately 0.2 to 0.24 mLs. Okay, once it is primed, you can go ahead and start. You can just say no, you're done. And then now you can say done because we're not doing the fill cannula. Okay, so now you can go to delivery program, press select. It'll ask you if it's a continuous rate. You say yes, press next. And now here is where you can adjust the volume mLs per hour. So press edit. And then you can use the up and down button. Okay. So once you've gotten your rate, you want to make sure to press done and not next, because if you press next, go ahead and fill next, it'll go down to the second line, and we don't want to put anything in that second line. So just make sure, again, once you've set your rate in mLs per hour, press done. Okay, press OK. And start delivery. Press select. And before you attach it to your patient, make sure you get a second RN to check your order and check your pump to make sure that it's the correct dose. Press yes. Again, press OK. And it is 0.03. Press OK again. And you're ready to go. So go ahead and press menu. So the pump looks like this when it is running. If you press any button, it'll show you the rate per hour of the medication. And then here you can see the battery life to make sure that you still have battery, you don't need to change it. And then again here it shows you the amount of medication that is still in the syringe. Go ahead and press menu. If you wanted to stop delivery, you can go ahead and do that and just select stop delivery. You just want to make sure that you don't want to stop the medication abruptly. Just make sure that you have a doctor's order before doing that. If you go to history, press select. In delivery summary or complete history, it'll tell you, go ahead and press select. It'll tell you the history of the Remodulin pump. So this one says continuous rate changed to 0.03 mLs an hour. And just go ahead and press back. And go ahead and press select again. Or sorry, back. To go back to your main menu. And then once you're done, you can just leave it and the pump will go back to the running mode. So the supplies needed to insert a subcutaneous catheter site for a Remodulin infusion. You would need the Medtronic Silhouette, either a 13mm or 17mm catheter site with tubing. You need an alcohol swab, the Cavalon no sting barrier, the Duoderm extra thin and cut into a rectangular piece, the coverall, one that is cut the same size as your Duoderm, and one long strip for chevroning. Then you would also need the IV 3000 one hand strip. So cut it into 2 strips, just like that. And you're ready to insert. Now we're here to show you how to insert a catheter for a Remodulin infusion. First, you want to choose the correct site. For neonates, it's the lateral thigh. It's also a good idea to get another person to help you while you're inserting the catheter. That person can help hold the baby's leg while you insert. So the first step, make sure you wash your hands, don some clean gloves. When you're done with that, go ahead and take an alcohol swab and cleanse the site for 30 seconds and allow it to dry. Next, take your nose sting and allow to dry. Now you can take your catheter, fold back the top portion, take off the blue plastic cap for the needle, insert into the skin about 25 to 45 degree angle, making sure you are not in the muscle. Take the sticky part off the top and place it on the baby. Remove the needle, discard in the sharps container, fold back, take off that part, and secure in place. With one hand, hold the catheter while you take the tubing, take off the cap of the tubing, and push right in. Next, you want to do the dressing. Take your IV 3000, place it on each side to keep catheter in place. Make sure you take that part off. So just make sure it's all the way closed on the other side also. Perfect. Now you want to secure the tubing on the baby's leg. Put a duoderm underneath the tubing. Take your long strip of coverall and just chevron around the tubing. Okay. Now take the other piece of coverall, already have the date and time on there, and put it on top of your tubing. And that is how you insert the catheter for Remodulin.